Great. Yes. Well, thank you for that glowing introduction. I hope we can rise to the occasion like meteors in the sky, that will continue to this be brilliant. I'd like to begin by stating that this is really exciting. I think the Pathway project really speaks to what we have been doing in the spirit of collaboration in teaching for medical students and preparing them for both interdisciplinary team partnerships as well as community campus partnerships as being fundamental and central to their learning experience and to their future practices. So that's foundational to what I want to instill in the students that we have through our community health division and in this presentation to bring my students, to lead students along to basically demonstrate that that's what's happening. For me to be a talking head and simply describe all the wonderful things that we're doing doesn't really do justice to having what's really going on the ground. And that's having the students actually speak for themselves and state that, yes, we are very excited and we are very engaged and we get it in terms of the community campus partnerships. So if you want to just go ahead and change the slide, great. So just briefly, the Community Health Division, it's within the Georgetown Department of Family Medicine, and we partner with the USAID and the Center for Child and Human Development. We have been in existence probably for about 20 some years. We've transitioned to do a lot of work with the IDD population probably within the last 6 to 7 years. And that has really, I think, changed and increased the interest amongst the student body and by extension, interdepartmentally, as well as across campus to gain interest in the work that we're doing, which I think is critical. You see there, the CHD, Community Health Division, has two functions: to engage in research that's truly participatory and community facing, and then to provide an integrative educational experience for students to recognize the importance of integrative practice and inclusive practice. And this is just a picture of some of the folks on our team smiling because they really enjoy what they're doing. Next slide. So as a pedagogy, I should also mention that the instructional component is presented through our community-based learning course, which is housed within the Community Health Division. There's been this tug with our other faculty and other courses to take CBL out of the Community Health Division and house it within medical student education. And I very successfully kept it as sort of a separate entity within our division, because structurally as well as philosophically, that is really where it belongs. And I think the strength of CBL really comes because it's within the texture and envelope of the Community Health Division, rather than just strictly within medical student education, which would have a different face and a different approach. And it's rooted in experiential learning, leveraging students to really infuse a practical interpretation to what they're learning in the classroom, so that it really provides a translational approach to learning. And that, I think, leads to then effective partnership solutions with the community, which in my mind really is what is going to catapult change. We'll get a little bit later into some of the projects that have really demonstrated that change in the intellectual developmental disabilities community. And again, these are some more pictures. In addition, we also have some of the advocates that work with us in that framed picture. So why do we have community-based learning? Because as I mentioned, the structure of community-based learning is to give students as well as experiential knowledge, so that they can then come into the practice environment with an understanding and appreciation of the social determinants of health, the importance of health equity and health justice, and to integrate their knowledge with both lay and professional advocates in the community so that they can be effective as change agents. It also allows the students to delve a little bit into policy and legislation where change happens in a more of a population-based community health forum. And so with the knowledge that they have from this contextual learning in CBL, they really begin to become human advocates, what I call servant leaders in their community. So the components you see here in the little circle: clinical skills, contribution to the community, communication skills, understanding social and cultural context, and then of course applications with experiential learning. Next slide. Yeah, so the curriculum actually is fairly old in the sense that it was 1995. It started as a very small entity, as a Pew Commission pilot to determine whether community-based learning could actually be successful within medical education. It certainly proved itself well. We grew from a very small group to now 26 community partners around the greater DC metro area. And you can see the population is quite diverse, and it includes individuals who are living in the community with varying disabilities. Next slide. So when we translate to the virtual environment, which is something we had to do within the last year, that's a whole different structure of experiential learning, right? And we had a very short period of time with which to do that. We had 2 weeks with which to take everything that we were doing experientially in the community in terms of our partnerships and our projects, and now put them online. Daunting task, but I believe we rose to the occasion and seamlessly rose to the occasion and continued having our virtual platform serve as a successful medium for engaging across the spectrum of individuals with disabilities, those who lived independently, those who lived in more of the traditional ICF arrangements, extending also into the hospitals. One of the groups that we partnered with that really helped us successfully do this was Project Action, and some of you may be familiar with Project Action. In fact, hopefully some of the advocates will be able to engage with this particular PATH consortium grant project as it develops. The curriculum change that we had to then modulate onto the virtual scene came out of a class that I taught last year and provided the competencies around health, public health, and the information that's required to effectively address health within our disability population. And then from that didactic element, students then began to engage in their community work, which is the community-based participatory or action research. Next slide. Some of the outcomes here, you can see, so students have more of an inclusive adaptation and thinking about the variety of populations that they're going to be serving within the disabilities community. DC is rich in cultural diversity, so perfect platform for them to learn about inclusion and justice. One exciting thing is the students don't just finish their community-based learning course and then move on to the next. They really stay with the partners, and they engage and form their own unique partnerships with the organizations that they have worked with, which I think is very exciting, and developed their own projects that then have iterations down the line. They also become engaged in the student groups on campus, and there's 2 here that are listed. And they also engage in some of the committees, even at some of the more executive and departmental levels, advocating and addressing the need for further integration into the curriculum about and around disabilities. I hope you can hear me. My internet's getting unstable.
Yes, we can hear you so far.
Great. Okay, great. Next slide.
So
So I'd like to transition to my students because this is truly a partnership and they are the success of the Community Health Division. So take it away, Megan and John.
hi, everybody. My name is Meghan Chin. I am a medical student here at Georgetown, and I finished my second year and then took a year off to work with Dr. Bullock and learn more about the physician in the community, as well as the role of the physician working with the IDD population. So I'm really excited to talk about what our student group has done so far. Our team has taken the virtual model of this community-based learning that Dr. Bullock has talked about and translated it to our student research group. Building on the strong community partnerships that we've developed, we've been successful in developing a number of projects and cultivating a team of students who have diverse interests in the IDD community. In our research, IDD community members act as partners and provide input at all levels of our study design. Our team currently has 17 active students at varying levels in their education. We have undergraduate, graduate, and postgraduate learners. And this variety in career stages really allows us to have a mentorship pipeline where learners at every stage are both receiving and providing mentorship to others. We hold weekly meetings for our projects, which include our health and nutrition literacy initiative, which we'll talk a little bit more about later on, as well as our COVID-19 disability advocacy and grant writing groups. Our students have participated in local and national organization meetings, including the AADMD, Project Action, and local DC community and provider forums. And very excitingly, our student leadership is currently applying for the Len Fellowship at Georgetown. Next slide, please. So what are our current projects and what's our student output? Our student team has been quite productive over the past 6 months, and we're really excited to share what we've accomplished. From our community listening sessions with self-advocates, we've contributed preliminary data to the Biden-Harris Health Equity Task Force. We've partnered with National Children's Center to create a virtual health education and literacy program where we provide monthly education to families of children with IDD. On the top right, you can see a screenshot of one of our brain health events. There's one of our students presenting on omega-3s. Developed by our student leadership, our students engage in a mini lecture series where they create and present on disability studies topics of interest to the group. These presentations are saved for onboarding new students in the future. And on the bottom right here, there is an example of a student presentation on disability activism. We've put out newsletters detailing our work at the Community Health Division and are currently working on a Disability Pride Month circular to celebrate the self-advocates who have generously partnered with us. Our students have also engaged in numerous scholarship activities, including the development of presentations, posters, and future publications. Notably, our students have taken the initiative to apply for grants and for their own funding, with several students receiving awards to partake in summer research with us. We've also contributed to grants with our community partners. We've recently submitted a grant with National Children's Center to develop a smart irrigation system for their urban community garden. Next slide. And I'll pass it over to my colleague, John.
Great. Hi, everyone. I'm John. I just finished a master's at Georgetown, and I've been working with Dr. Bullock since I took her summer course that she mentioned. So almost a whole year that we've known each other and been working together on these projects. Just a quick fun note. The first time I met Dr. Bullock in person, it was a very strange experience because we had worked together for like 6 months on Zoom. But we've been focused on both building community virtually with our community partners as well as with each other. And so I'm going to touch on some of those notes. With community partners, especially those at disability advocacy organizations like Project Action, as well as other places like RCM of Washington and the L'Arche communities, we've been able to engage in listening sessions that Megan mentioned that went on to inform qualitative data that we've been sharing with the Health Equity Task Force. We've been throughout the time of COVID, addressing concerns that parents of children with IDD are having with, the continued craziness of new information that is continuing to pop up with things like COVID-19 through hosting parent cafes and town hall events with community partners where we can kind of provide some health expertise and have conversations and listen to folks' different concerns regarding the pandemic as it has evolved. And I think overall we've found that the virtual environment has been a great alternative to in-person community. Yeah, could you move to the next slide? Great. Yeah, so we've touched a little bit on Project Action before, but they're really sort of like our core, almost like community advisory board for most of the things that we're doing in terms of community research, and then also they're very instrumental in the community-based learning sections that are focused on disability rights and disability advocacy. So we attend Project Action meetings monthly as supporters and co-advocates with them, and they are wonderful in providing their insights on study design for our projects on the student research side, but then also being very gracious to attend additional events that we're having within community-based learning so that students can ask questions like one of my favorite questions that we usually ask advocates is, as a person who, like, I'm going to study medicine someday, so as a person who's going to be a doctor in the future, what is it that I could know about you that would make me a better physician for you in the future? And like getting to ask those types of questions and to listen to real stories about difficult experiences in the doctor's office or with receiving care or accessing care makes us better clinicians going forward. Next slide.
So yeah, I'll take this one. So for our community partnership with National Children's Center, we've been able to develop a health and nutrition literacy initiative. Just some background about National Children's Center. They are a multidisciplinary community-based education center, mainly for children and families with IDD, but also they do support adults. As you may or may not know, Wards 7 and 8 in Washington, D.C. have some of the poorest health outcomes, largely due to social determinants of health. This includes systemic racism, inadequate access to healthcare, and food insecurity. So in 2017, National Children's Center developed Baby Bloomers Farm with the goal to provide healthy food access to community members while also teaching and empowering children and their families to grow healthy foods. And if you see on the top right there, there's a picture of our Baby Bloomers Farm, or NCC's Baby Bloomers Farm, in full bloom from a couple of days ago. And so this partnership really grew out of the desire to educate families on health and nutrition and how to cook well for themselves and their families. So we do monthly presentations centered on the integration of nutrition with the context of a specific body system. So we started off with the integration of brain health and nutrition. We've moved on to the integration of the GI system, the microbiome, and how nutrition will affect that. And most recently, we are starting our food allergy initiative. As you can see, we have partnered with the center's wonderful 5-star chef, Chef Nelson, to create interactive and culturally inclusive cooking classes. You can see on the bottom right, that's one of our students filming a video with our Chef Nelson for our food allergy session. And these recipes, this video is demonstrated for our families during our sessions, and then the recipes are shared so that they can try this at home.